Hi, I am Revati, Assistant Professor, Department of EEE, SNS College of Technology. In this lecture series video of Biology for Engineers, today's topic is malnutrition. So, what is malnutrition? So, undernutrition or overnutrition is known as malnutrition. That is imbalanced intake of nutrition. So, uh, people may leads to poverty, so they can't get enough nutrition values. That comes under the malnutrition. Affects all age groups, but especially harmful to children and pregnant women. So we have to take a proper nutrition food for it is mainly important for children and pregnant women, so that uh, without achieving this nutritional value, we may leads to the condition called imbalanced intake of nutrition, undernutrition or overnutrition. So types of malnutritions are low weight for height. So we are not achieving the BMI value, body mass index value. Underweight, low weight for age. Stunning, low height for age. Micronutrient deficiency. And overnutrition is weight and obesity. So obesity is the overweight, and lot of intakes of calories and fats may leads to overnutrition. So these two condition is the major type of malnutrition. So person who are low weight are not only called undernutrition. Person who are low in height for the age is also called as undernutrition. So person who are obese and overweight is called overnutrition. So, causes of malnutrition. So, what are the major causes of malnutrition? Inadequate dairy intake. Some may not likes, some may dislikes the dairy products, which is mainly a milk. So, if you are avoiding dairy products in a regular interval, that may lead to calcium deficiency, which is also known as the malnutrition. So, poverty and food insecurity is the major causes of malnutrition. So, some kind of peoples doesn't get any proper nutrition because of their poverty, because of unemployment or something else, which is financial lagging is the main reason for malnutrition in certain countries. So poor sanitation and infection. So people who are getting a proper nutrition, proper lifestyle, they are lagging in sanitation and infection. So regular affecting by infection may leads to malnutrition. Lack of education, they are not consume a proper diet. Though they are consuming a lot of food, which is always a carbohydrate, but not a proper nutrient, proper greens, proper vegetables, that may also leads to a malnutrition. Natural disaster and conflict zones. So in that zones, people may not receive any proper kind of vegetables or fruits, something else, which may lead to a malnutrition. So, common symptoms of malnutrition are increased infection risk, worsening malnutrition, poor nutrient absorption, weak immune system. So, body's metabolism plays a major role in absorbing the malnutrition, absorbing the nutrition capacity. So, if you are over a high metabolism rate, you have to take the proper diet for the absorption in your body. So, signs and symptoms of malnutrition are fatigue, dizziness. So, people may always feel like a dizziness, so which is also caused by iron deficiency. So, weak immune system. They are not in the proper count of WBC, which is responsible our immune system. So, whereas WBC is commonly known as white blood corpuscles, which is highly important for our body's immune system. Poor growth in children, dry skin, hair losses. So lot of losses in your hair, which may looks like a blood. So that is also one of the types of malnutrition. Swelling or bloating, which is caused only in the area of a stomach, whereas the stomach part is looks like a big belly. So that is usually called as a kwashiorkor. Whereas in dry skin, skinny look, a skeleton like look is also known as a marasmus, which is also caused by the malnutrition. So, malnutrition in children. So, in a critical age, first 1,000 days, which is exceptionally age of 2 or 3. impairs brain development. So proper nutrient intake may leads to a brain growth. So lagging in the nutrition, which is also affects the brain's development. Increased risk of illness and death. So if you are not getting a proper food, proper diet, proper nutrition, you are always leads to a illness, sick. You always feel like sick. So that leads to illness and also causes death. So long term effects on education and earning potential. So these are all the things which is caused by malnutrition in children. So malnutrient deficiency is iron. So already I have discussed about iron deficiency, which is a major causes in malnutrition. So which leads to anemia and fatigue. So anemia is wherever you are lagging in iron content, your hemoglobin level is very low. So the normal hemoglobin level is 13 to 15 for male and 11 to 13 for female. If you are not achieving this hemoglobin level, you are basically an anemia patient. So concentrate more on the iron content. So vitamin A, which leads to night blindness and immune issues. Iodine, which is goiter, which is your neck part is little bit swollen like structure. So intellectual disabilities. Zinc, which may leads to growth deterioration and immunodefunctioning. So these are all the malnutrient deficiencies. Global statistics says that over 820 million people go hungry worldwide. So 45 million children under 5 suffers from fasting, and 148 million children are stunned. Obesity is rising in both developed and developing countries. So increased amount of IT jobs and 8 to 8 hours sitting jobs may leads to obesity, and proper not taking a proper diet. They are highly concentrating on the fat based diet, so that obesity is increased in developed and almost in developing countries also. So effects of malnutrition is physical, mental, and social, economic. So in physical, growth failure, disease vulnerability; mental, for poor congenital development, learning difficulties. So in social, lower productivity, increased healthcare cost; economically, it is burden on families and national development. So, what are the prevention and solution for malnutrition are promote breastfeeding and proper weaning. So, under the age of children too, which we may not external supplement is needed up to age 1. Mother's milk is the best for babies for absorbing large amount of nutrition. It contains breast milk contains a lot of nutrition value, which is enough for the children so below age 1. So, frosty stable food with vitamins and minerals, provide nutrition education. Government and NGO programs or the improve food security and access to nutrition are the best way for the prevention and solution for malnutrition. So, what are all the roles and schools and communities are school feeding programs. So, lot of schools is having this program. So, school feeding programs, teaching nutrition in the curriculum, community health workers and outreach, hygiene education to prevent diseases. So, some of the roles is of schools is to improve the nutrition value in the society. Thank you.